So if you have a significant snoring or sleep apnea issue, you may have recognized that many different disciplines are working to try to resolve that condition. As it turns out, in our field, the ear, nose, and throat field, we understand that anatomical blockage of the nasal airway is a primary driver of snoring and sleep apnea, as a restricted airway produces rapid and turbulent airflow, which vibrates the soft palate and uvula and pulls the tongue back into the airway, generating the snoring and sleep apnea. It's interesting, but if you do have a nasal blockage issue, mouth breathing will result, and that creates progressive enlargement of the tongue. If we have worked hard to make your nasal airway perfect, and the patient's still having significant tongue-based snoring, it's usually secondary to the fact that their tongue has become enlarged over time. The addition of a custom-made oral appliance by one of the sleep dentists that we work with that comfortably fits on the upper and lower teeth to close the mouth and bring the jaw slightly forward can effectively move the tongue base away from the back of the throat to open that space and also further improve the snoring and sleep apnea. If you have reached out online and purchased one of these types of oral appliances that are not custom made and really not had a good response to that, it may not mean that that's not an effective form of therapy for you. It may just need to be custom made and appropriately titrated, and more importantly, the nasal airway probably needs to be evaluated to treat that as the primary driver of the condition so that the two forms of therapy can work cooperatively together.